Welcome to SSM Health Monroe Clinic Medical Group's To the Point. I'm Kent McConnell, and we are visiting today with Dr. Kelsey Schmidt, part of the primary care clinics in Brodhead and Albany. Dr. Schmidt, welcome.
Thanks so much for having me.
We want to thank you for joining us on To the Point. And here in August, we are recognizing National Breastfeeding Month, and you recently became a certified lactation consultant. How about telling our listeners about what inspired you to complete this training?
So it actually all started about 4 years ago. I was completing my family medicine residency training up at UW, and as a second-year resident, I became a mom to a wonderful little girl. And I knew the benefits of breastfeeding, but I didn't have any of the practical knowledge that I needed to make it a reality. Luckily, I had a very supportive family, and I was surrounded by some pretty amazing physician mothers who shared many tips with me and helped me through the early postpartum days. I formed a wonderful breastfeeding relationship with my daughter, and that inspired me to gain more knowledge and training so that I could work through any difficulties that we had and also extend the support I had received to my patients. During residency, I completed some special electives in breastfeeding medicine and obtained CME from an organization called IABLE, the Institute for Advancement of Breastfeeding and Lactation Education. And then more recently, that's when I completed my certified lactation consultant course, actually when I was on my second maternity leave with my son. I always knew that I'd come back home to practice medicine, and I wanted to expand breastfeeding medicine to the rural clinics where I work. I have the privilege to work with both moms and babies, so it's the perfect opportunity to also do breastfeeding medicine as well.
Now, you made mention, Dr. Schmidt, of wonderful relationship you developed with your children. What are some of the benefits of breastfeeding?
There's many benefits for the baby, the mom, and society as a whole. These range from nutritional, cognitive, medical, and relationship benefits. I'll touch on a few of those. Specifically for the baby, we found there's a decreased risk of sudden infant death syndrome, diarrhea, ear infections, obesity, eczema, type 2 diabetes, and increased IQ. These result in less medical visits and less medical interventions over time. For the mom, there's decreased in risk of postpartum depression, breast and ovarian cancer, as well as type 2 diabetes and cardiovascular disease. Also just in days lost to the illnesses for the baby in terms of being back to work and that sort of thing. The science behind these benefits is really quite fascinating, and that's a lot of the training that I've received delves into that. Breast milk is actually a living substance, and it's always adapting. So it's full of antibodies, hormones, white blood cells, and fat, as well as many other substances. And it changes in composition over the course of lactation, within the day and actually within a feeding, so minute to minute. Some of the research behind decreased infections in the newborns is because antigens go from the baby into the mother's milk ducts, and then the mom can make corresponding antibodies to whatever the infant's been exposed to, even if the mom hasn't been exposed to that virus herself. We also see now in the COVID pandemic that the COVID antibodies, if the mother is vaccinated, get transferred through the breast milk as well.
Often, Dr. Schmidt, we hear parents talk about their feeding goals. Can you share what some of the different goals are and how those can be successfully achieved?
Every infant, parent, and family are unique, so we really try to focus on very individualized goals. There's not a one-size-fits-all approach. Some goals are time-based on the order of days, weeks, months, or years. Other goals are related to the type of feeding, so exclusive formula, exclusive breast milk, a combination of the two, sometimes in the method of feeding, so be it direct breastfeeding or exclusively pumping. Some other goals might pertain to involving a partner in feeding the baby or maintaining a breastfeeding relationship when the mom goes back to work. Whatever your goals are, our job as healthcare professionals is to help you through the process and kind of whenever any roadblocks come up, work through those with you. There are a lot of roadblocks that come up for folks, sometimes in the early hours with skin-to-skin contact in the golden hours after birth. And in the early feeding days, infants can feed up to 10 to 12 or more times in a day, and that can be a lot of work for the mom in the early days. Sometimes women develop a painful latch, and that can be improved on with the help of a certified lactation consultant or physician. At the end of the day, it's important to remember that fed is best. Formula is a life-saving medication and can help get the baby the nutrition they need. If supplementation is needed but was not the initial plan, I recommend working with your certified lactation consultant or family medicine doctor or pediatrician to continue to meet your goals over time. I also just wanted to mention that the American Academy of Pediatrics just increased its recommendations to support continued breastfeeding along with appropriate complementary foods introduced at 6 months, as long as initially desired by mother and child for 2 years or beyond. I have found that toddler nursing is stigmatized in this country, and I want to work to decrease this stigma. Prolonged breastfeeding is developmentally normal and is done around the world. Toddler breastfeeding can have its own roadblocks, such as nursing strikes, but with the help of your healthcare team, we can help children and their parents there as well.
What do you think is the biggest misinformation people have about breastfeeding?
I don't know if there's one biggest misinformation. I think that there's a lot of misinformation circulating about breastfeeding. I find that sometimes well-intentioned family and friends are trying to help and support a new mom, but there are long-standing breastfeeding myths that get perpetuated, and those can damage the breastfeeding relationship. I'll touch on just a few of these. One is that it's so easy, or it's so natural, it's going to be easy, or the opposite, that it's so difficult, it's not achievable. And I think that most of the time with proper support, it ends up being somewhere in the middle. It's really time intensive at the beginning and takes hard work, but there are many benefits, and it can be worth the investment. With the increase in social media, I find that there's a lot of misinformation being spread there as well as a lot of advertisements for different products that are not needed in breastfeeding. There's new things on the market, such as lactation massagers, which can damage the breasts and should not be used. And I also recommend against using pacifiers and nipple shields if able. There's a lot of information online, too, about pumping and dumping. There's actually very few reasons why you should not feed breast milk, so checking with your doctor about certain medications or substances that are contraindications, but otherwise, usually you are able to feed breast milk. I could go on, but the last one I will touch on is about newborn sleep. It's sometimes said that if you add rice or formula, that your baby will sleep longer at night. This supplementation can actually decrease the amount of night feeds, but not night wake-ups. So at 3 months, there was a study that was done, and 3-year-olds actually were sleeping 45 minutes longer if they were exclusively breastfed. So I would recommend not adding additional supplementary or complementary foods until 6 months as advised by the AAP.
Today we are visiting with Dr. Kelsey Schmidt, part of Monroe Clinic Medical Group's primary care clinics in Brodhead and Albany. And Doctor, as a mom, how did your own journey help inspire you to provide support to other parents?
My life changed completely 4 years ago when we had our daughter, and again a year ago when we had our son. Nothing completely prepares you for the experience of motherhood, and it was the best thing that ever happened to me and has been a really humbling experience as well. I think that being a mom has made me a better physician because not only do I have the education and evidence-based background, but I also know firsthand the practical and emotional side of parenting too.
What lactation resources are available at SSM Health?
We have lots of resources at SSM. First of all, we have breastfeeding classes and one-on-one support for new parents. You can talk with certified lactation consultants at family birth suites in the hospital, and then also outpatient in the pediatric departments and the family medicine departments, both in Monroe and then also at the branch clinics. And we're also working with Greene County as part of the Greene County Breastfeeding Collaborative. So it's a team of people working to increase education, decrease stigma, and increase support in our county for mothers and babies.
If there are any of our listeners out there who want to meet with a certified lactation counselor, how can they do that?
Sure. All they have to do is call to schedule an appointment. They can come and see me in Brodhead or Albany, and they would call 608-897-2191. They could also call pediatrics to see Dr. Rebedu or the certified lactation counselors there, and that number is 608-324-2337.
We've been visiting today with Dr. Kelsey Schmidt, Monroe Clinic Medical Group's primary care clinics in Brodhead and Albany. Dr. Schmidt, thanks for being with us.
Thanks for having me.
For Dr. Schmidt, I'm Kent McConnell, and you've been listening to SSM Health Monroe Clinic's Medical Group's To the Point.